Mhm. Hi, everyone. This is Carmen Bonilla, and today I will be engaging in conversation with Chris Wojton. Chris is a doctor of physical therapy with 9 years of experience in both outpatient settings as well as nursing homes settings. And he has actually been my physical therapist for this last 2 years. So I'm very excited to invite him for this conversation today to talk about the wellness impacts of the pandemic and what he has been observing in terms of the needs that patients have been showing when they come to his office for services. Welcome, Chris, and thank you for joining us.
Hi, how's it going? Thank you for having me.
Wonderful. So, Chris, we have been talking in conversations about the patterns you have been noticing. We are located here in the greater New York City area, which has had an extended um, quarantine, if you want to call it that, right? Since
Yeah.
March, and so please tell us from your perspective as a physical therapist. What are the patterns you have been seeing in patients during this pandemic that are related to working from home?
Yeah. One of the biggest things, I mean, obviously, when you're more quarantined in your house, everyone is a little more sedentary. So, just even the normal activity that people got from here in New York, especially with more walking, going to and from work, just being out and more active and everything like that. So, we saw, that get cut in half or more. So, everyone is just being more sedentary lifestyle. The other big thing that we saw more is with low back and neck pain. And that was just more from sitting at a at-home desk. Most people, when everyone got kind of sent home from work and we were on quarantine to start here, we had no idea how long it was going to be. So most people didn't take anything from work. They just were like, oh, it'll be a couple of weeks. I'll work at home and then I'll be back in my office. But a couple of weeks turned into a couple months, and now we're almost approaching a year of this working from home. So we definitely saw an uptick of upper back, neck, low back pain since the pandemic has come on.
Mhm, mhm. Absolutely. That's very true, right? There was just very little time to prepare. This just happened at the beginning of the quarantine. Seemed like it was from today till tomorrow.
Exactly.
Okay,
Yeah.
now go work from home.
Yeah. Yeah.
And so I've definitely heard from many of my connections how they have been working from a sofa, from the kitchen table,
Yeah.
etc., which are less than ideal settings, as I have been learning. Um, and so, as you mentioned, those issues in upper back and neck, what are the consequences, and why is it important for us to take care of those issues?
Yeah. So, I mean, immediately, most people will start to feel some, either tension, pain, either in the neck or the back, which can obviously, impede you from doing certain things or want to do certain things. But more long term is if you're in those more poor postures, or the kind of rounded shoulders or kind of rounded back from sitting in a chair for so long, or like you said, on the couch, like some people are working from home doing, that can over time can strain a lot more of the muscles in those areas, and eventually, because the nerve roots to the arms come out from the neck area, the nerve roots that go down into the legs come out in the low back area. Eventually, you can start to put some pressure or some irritation on those, so you could start to develop some neurological type issues like either numbness, tingling. I mean, if it would get so severe, it would be more like weakness and stuff like that. But a lot of times you start to feel some more numbness, tingling, and those kind of issues that start to um, pop up in a patient.
Mhm. And I'll confess, Chris, when I hear that word neurological issues, wow, that gets my attention. That sounds very serious to me.
Yeah, and it definitely can be. It can definitely turn into something more serious if you are in a position or in a poor sitting position for so long. Because most people here, at least I found out in New York, most people don't work just 8 hours. They work, 10 to 12 hours, and especially now that they're at home, um, they're always next to their computer, so they're usually working even more now.
That is very true. We have certainly started seeing in the business press reports about employee burnout, and
Yeah.
this can be very addictive,
Oh
having
yeah.
the computer on all the time,
Yeah.
and wanting to be competitive and available all the time. And so, knowing about these problems, Chris, how can we prevent or resolve these problems if they have already appeared?
So yeah, obviously, the sooner you address it, the better, because then your body just doesn't start to get in some of those positions, and you don't get more used to that, and things start to tighten up, or you start to get more issues. But the biggest thing would be, postural, especially with your sitting and everything like that. Making sure, for the neck, making sure the shoulders stay back, that you're not, kind of rounded over the computer. Also making sure that, now that it went a little longer than a couple weeks, making sure that your at home setup is more ergonomic. So having the keyboard at a certain height, having the screen at a certain height, so that you are more in that optimal position, so that you're not, rounding your shoulders and kind of hunching over at the desk there. If it's optional at someone's house, having like a standing desk, um, is something that could be helpful as well, because that keeps you in a more extended position and doesn't allow you to kind of round forward as much.
Mm,
Um,
mhm. Yeah, that makes a lot of sense. And so, both sets of suggestions are very compelling and very very interesting to me. I definitely can see the value of this. Something that worries me a little bit about the postural suggestions. I find myself sometimes it may be hard to really be conscious and aware of how am I sitting, and and even I may not feel pain at that immediate moment. So I'm curious if you have any suggestions about how do we become more aware of postural issues where we may be, sitting in a way that is not beneficial to our bodies.
Yeah, so I mean that is usually the toughest thing for a patient that when I usually work with them is, I mean, because we can address your some of the issues that you have going on, either with tightness in the muscles or weakness in the, like, the back area. So that's typically the scapular muscles that will help keep the shoulders back. Um, those are somewhat, I guess, the easier things to address, because I can give the patient exercises or stretches. They can, as long as they do those and everything like that, that will usually address those issues. But yeah, if you're going to be, we can strengthen areas up, or stretch areas out as much as we can. But if you're going to still sit in a bad position for 8, 10 hours, 12 hours, I mean, that's going to trump anything that we work at in the office. So the biggest thing is trying to, teach yourself that you got to stay in that better posture longer. It's almost like a neuromuscular education, which is usually the hardest thing for a patient to start doing. Some of my suggestions that I use for them are, either set an alarm on your phone, like every half an hour that just goes off, and it kind of reminds you, okay, I got to keep my shoulders back, I got to, sit upright. Or, if, like I said, if you have the standing desk option, go from sitting in a chair to standing for a couple hours, and then go back to sitting. Another thing I usually tell patients to do is, take just a little post-it note and stick it on the side of the screen. So while you're working, every once in a while, your eyes catch the post-it note, and oh yeah, that's right, I got to keep my shoulders back, keep my shoulders back. Eventually, you will get more used, you'll get used to that, and you'll start to feel yourself get out of that good posture, and you'll just automatically know that you've got to get back into it, without some of the cueing.
Mhm, mhm. Good. And then you also mentioned the setup of the office furniture at home, and that is definitely something that I have been receiving advice on how I need to go from working on a very small laptop to a larger keyboard, etc. You also mentioned the standing desk, and I actually chose to stand for this conversation uh, based on your advice. And so, Chris, can you tell us more about what are the benefits of standing while working or using a standing desk?
Yeah, so I mean, I wouldn't recommend using a standing desk for the entire day because then you may start to have some more issues, either, fatigue in the legs or just, feet bothering you and stuff like that. Because obviously, one position for too long is never the best.
Mhm.
But yeah, definitely being able to switch back and forth from sitting and standing is definitely very, very helpful. Because when you are standing, your low back is in a more what we call extended position. So when you're sitting, you're in a more flexed position where the shoulders are kind of rounded forward. The low back is rounded over. Also, just to even address more like in the hip and the leg area, your legs are in a more flexed position as well. So the muscles on the anterior portion of the leg tend to tighten up because they're in a more shortened position when you're sitting. So when you're standing, though, you're starting from the bottom up, your legs are now in a more extended position, so those muscles on the front are now in a more extended and stretched out position, so they're not going to tend to tighten up and shrink up, and bother things down the line. Low back again is in a more extended position, which is a little bit better for the muscles and putting pressure on nerves. And then also going back up to the shoulders, when you're in a more standing position, it is more normal, I guess, to say to have the shoulders back, and not to be kind of hunched over the computer. It's also harder to get hunched over the computer because you'd really have to be like leaning on your desk and kind of really draping over. And hopefully, at that point, you would know that you're not in the best position.
Right, right. And also something that I'm noticing as I'm standing here is that my eyesight is pretty much at the height of the computer. So I'm not looking down, which has been a reason for neck pain.
Exactly. Yeah. And I noticed like a lot of people in their home setups, they have more laptops, and a laptop isn't the best thing for an ergonomic setup because the keyboard and the monitor are too close to each other. So
Mm,
if you have the keyboard and the monitor at a good eyesight like you do right now, the keyboard's going to be too high, so your arms are going to have to come up pretty high to type on it. So I do try to recommend for my patients, if they do have a laptop,
mhm.
try to get a wireless keyboard or something where they can move the keyboard lower so it's the shoulders aren't shrugged up, and their arms are at a more comfortable position.
Right, right. That's such a great point. That is such a great point. So you see, our viewers, we are all learning about ergonomics here. Crash course on ergonomics, thanks to the pandemic and
Exactly. Yeah.
and our home office setups. Wonderful. And so, one more question that I wanted to ask you. Sometimes you suggest, right, switching positions, sitting, standing, etc. And sometimes I have noticed myself, I may resist that a little bit, and I may not take that advice as much as I should. What advice would you give for dealing with that resistance, that wanting to, I want to remain sitting for the next six
Yeah.
hours?
Yeah, I mean that's a hard one. I don't know. That's the one I deal with every day with patients. Like I said, we can do exercises. I can strengthen areas and improve flexibility, but I ultimately can't make a person sit up with good posture. There are some techniques that we can use. So I know most people, or at least patients, have talked to me about like the straps that they've seen on
Mm,
TV or on the computer and stuff like that in ads. Those are helpful to kind of give you the cueing to bring your shoulders back. I don't like them, as much because anytime you use something else to do what your muscles are supposed to do, you can start to develop some atrophy, or your body just gets used to something else doing the position for you. So at first, they could definitely be beneficial to help kind of get you in the mindset to keep the shoulders back. But I would say long-term use, I wouldn't look at using those as much, because you are
Mhm.
going to get some atrophy and you're just going to rely on something else to do the work for you.
Yeah.
In the office, we do use some like kinesio taping, which is it became more popular in the last like Summer Olympics. A lot of the
Mm.
volleyball players had it like all over their arms and the different colors and everything like that. But what that does is essentially the same thing, except it's not going to, provide the complete support for you. What it's going to do is cue your muscles to help kind of bring the shoulders back and to be in that better posture there. But yeah, it is a tough one to make patients sit upright and do the right thing. But I mean, I try to give them all the tools that they can to do that at home. So.
Yeah. It sounds like we need to exercise some willpower and awareness.
Exactly. Yeah. That's the biggest thing. And I tell patients it's the easiest thing I'm going to tell you to do. It's just, yeah, just sit up with a better posture at home, but it's going to be the most difficult thing for a person to do.
Right, right. Thank you so much, Chris. Really appreciate your coming in and speaking with us, sharing from your thoughts.
Yeah, no, thank you for having me.